What we're talking about today is the idea of progressive or progressional rehabilitation. You want to take that away? Get
Yeah.
us started?
So, as therapists, and with anything, we like to simplify. So, there's different approaches that each therapist utilizes, and each one has its purpose and its place with different patients. But some of the main ones are like a pathoanatomical approach, where you're looking at tissue and trying to figure out what's injured and then correcting that. There's impairment based, which is a huge one, and it's if you can't do a function, let's train the components of that function for you to be able to. And then you're going to address some of the anatomical issues there as well. And then there's a pain science or like educational based, and that's a really sticky, like complicated process. But it's for like your people with chronic pain issues, which is a huge epidemic. And it starts with just sitting and talking. And so, you know, I like that approach, and we incorporate that into some of our clients, but that's a different way of thinking. And then there's protocols, which hopefully most PTs nowadays aren't sticking to straight protocols.
And those are like templates?
Yes, templates. And you can stray a little bit. And they have their place definitely, like post-surgical and that kind of stuff. Communicating with your surgeons is huge. But just each patient or client is different, so everyone shouldn't be getting a protocol.
Right.
And then there's progressional rehabilitation and like a strength training approach. And that's what I really like to use. And it kind of combines components of all of those, and then with a heavy strength component to it.
Because in reality, it seems like now you would use, with the information that we have, we would use those different approaches for different people and different places that they come from. And also some of that might change as they go along.
Absolutely. And it all starts on the assessment and when they walk in the door, like on the eval, we start trying to figure out what approach and what treatments we're going to utilize.
So for specifically, we have two things that we're talking about today. What are those two things in the assessment that may help you see which path that you're going to start them on?
Yeah. So the very first thing that I'm thinking of is if they're in pain, and that's why they're coming to see me, is are they in pain constantly all the time? They're just in severe pain, and maybe they're only resting at night, and that's when their pain is, goes away, but it's just when they're completely still. Or are they only hurting when they do something? So you have a runner who has knee pain, but it only hurts when they're running. So with those, you take a different approach from the beginning. So with the person that's constantly in pain, say they're constantly having back pain, on eval, I'm not going to poke and prod on them necessarily. I'm probably not going to do a whole ton of functional assessments or getting measurements and that kind of stuff, because it really doesn't matter right off the bat. My main goal is building rapport and getting the irritability down. So that way, further on in the program, we can do those tests and do those assessments and then build from there. Now, the person with knee pain, that's going to be more of a pathoanatomical approach right off the bat. So we're going to look at their different mechanics, their running mechanics, their ankle and hip joint biomechanics, strength testing, range of motion testing, and really trying to figure out and narrow what part of the chain is causing these symptoms. So it varies.
So you have that one. It's like, why is this causing this? We're trying to figure that out. With are they hurting constantly? And you may not jump into a mode, I guess, of one of these modes of physical therapy. Mm-hmm. Do you have people sometimes that come in that like they are like excited to get started and get going, and you're like, we need to like slow down for a second and get this thing calmed down? I think specifically I'm thinking of like a situation where you have like we had an offering and then someone came in and you were like, oh, this is different.
Yes.
Describe that to me, like someone that is almost, I think that scenario was like they were just too inflamed kind of thing.
So sometimes people come in and like they're just in such severe pain and they think that I'm going to be the savior and I'm going to fix them in a visit and it's going to be perfect. And with that, like you really have to have an honest conversation and manage their expectations right off the bat. And that's where the educational piece comes into it, because with them, no, we're not going to be doing major modalities that's going to fix this, because take needling, for example. It's a great tool. Dry needling is a great tool. But if your muscles are super inflamed, do you really want me to stick a needle in it? Like, that
Right.
sounds uncomfortable. So, I mean, and that'll come later on. But just explaining the process to them and letting them know, we might spend a whole session off the bat on education, talking about sleep and nutrition and their work hygiene and positioning and that kind of stuff and how those affect what's going on. And then from there, I also will probably start with doing more hands-on manual work. So like soft tissue mobilizations or massages, doing like just graded joint mobilizations, low grade. So just really just trying to pulse and just make small changes in that joint environment, the spine. I'm not, trying to have huge range of motion gains, but just really trying to, like I said, calm the irritability and just getting the tension and the muscle guarding down, because you have tons of people that are very excited to get going, but then therapy isn't a magic wand, or it's not a pill or whatever that I'm going to give them and you're going to fix. Like it takes work. So if you're not calmed down, we can't get started.
It's a process that you have to stick to. And so it sounds like lifestyle is a huge thing in getting that. And then, just starting out with things that will, I guess for a lack of better words, like relax their body so that you can work on them. So once we get into going down these pathways, do you always stay on the pathway that you started on?
Not necessarily. So my ultimate goal for anyone, typically based on their impairments, is improving strength and improving mobility or stability. A lot of injuries or just pain can be targeted that way. So, the person that's having back pain, they may have a diagnosis of a bulging disc or a herniation or whatever. There's research that says, a large population of Americans, or just people in general, have herniations and they're completely asymptomatic. So this person who's in constant pain has developed this pain, and then they've gone to the doctor and had imaging and says that they have a herniation. Now, do they have true neurological symptoms, numbness, tingling, that kind of stuff down the leg? That's different than just back pain. If they're having just back pain, it's probably more of a tissue tolerance and a load tolerance issue. So my ultimate goal is to get a barbell in their hand and do strength training, because, have them do deadlifts, because we know deadlifts are the gold standard for posterior chain strengthening. So we need to get the spinal extensors and all of that, hamstrings, glutes, all of that stronger to improve their mechanics and their muscle coordination. So that person, I am progressing to strength training, which is where the person with the knee pain, who we've started with that approach, is also on the path. So the paths will merge eventually as we progress to there.
Very good. That makes sense. I was getting ready to say, so you start on these different pathways, and in the end, for most people, maybe not all, we're trying to get to this single pathway.
Yes.
We're working on those things.
Yes, to make the lasting changes and to give them the tools to maintain those changes and help reduce their symptoms long term.
Maybe help them, not re-injure through strength training and fixing the imbalances. I imagine that you can overdo it in physical therapy.
Yes,
Talk to me
definitely.
about that.
So overdosing and underdosing is kind of a hot topic in the therapy world, especially now that there's tons of gyms and tons of therapists that work in gym-based settings. And so I'm sure it's been around for forever, but I feel like it's just really taking off now. Whereas typically you would have an orthopedic injury and you would go to your typical box outpatient orthopedic clinic in a strip mall type setting.
Mm.
So historically, not all of them have had heavier dumbbells or barbells and that kind of stuff. So now you kind of have this little dialogue where the gym-based clinicians are saying that the other guys are underdosing, where the other guys are saying that gym-based clinicians are overdosing. So it can be a hot topic. And the reality is there's probably a lot of both happening. But with overdosing, my concern is I can send the client into a flare up. Let's take the example of the patient with the back pain. If I prescribe the incorrect exercise or the incorrect dosage, so too many reps, too heavy of a weight, that kind of stuff, I can send them into a flare up that might cause them to not really be able to walk for a week. So then they're not going to be able to do their home exercises. They're not going to trust me anymore because I've screwed them up. And we're going to be backsliding. So I feel like it's a really delicate process. Whereas if you're underdosing, you're just not going to be getting the results. You're not actually going to be helping them. So it's a delicate balance. Now, to start with, I'm probably going to err on the side of underdosing because I don't want to risk it. And I need to get that irritability down, and I don't know how testy it is. So we start on the side of underdosing, but we quickly can figure out that gauge.
I imagine too that with overdosing or just overdoing it in general, it's the same thing with personal trainers where you can, if you're not careful, you can kind of give physical therapists a bad name. And not all physical therapists are bad. And that's probably where some of this conversation from that like clinic setting to like the gym setting, the clinic setting may say the gym physical therapists are overdoing it. The gym physical therapists think that the marketing's always like, it says, we're not just going to give you a red TheraBand in this. It's like, well, sometimes that's where they need to start.
Absolutely.
That's where they need to start. And then we're going to progress. So it's just the way it is, I guess, with marketing. Different ideas, different things, but there's a lot of right in both and then probably a little bit of wrong in some of it, just depending on where you go. But you don't want to be careful with it because you don't want to give physical therapy a bad name to where they're like, oh, well, I tried physical therapy and it didn't work. Well, you may have just had a physical therapist that didn't help you solve your problem.
Exactly.
So we get the right dosing, we get going in the right direction, we get the pain down. I'm excited. Now what?
Strength training, mobility training, stability training, all of that stuff. Once we're starting to get the irritability down and we're building on our program, we're going to be introducing new movements, new movement patterns and that kind of stuff. So it's going to be progressional each treatment as tolerated, obviously. Now, one thing to remember with this is hypertrophic changes, actual muscle gain, doesn't take place until after 6 weeks. So for those first 6 weeks, we're having tons of neural recruitment. This motor units are improving their synchrony and their firing capacity and speed. So we're having some big changes there. So once we get the pain down, that's when we can really just start building. Because my goal is, we need to get the load tolerance up, and then you need to be able to maintain that load tolerance for the future.
Yes. So it's almost like you are in some ways sounds like you're like relearning movement, even though you may have done the deadlift before. It sounds like with you, we're going to, with that motor recruitment. We're going to be relearning how to activate the core and make sure the right muscles are firing properly before we start to build the weight. But that is going to be the base that we're going to start with that strength training.
Absolutely. With a deadlift, it starts from the ground up. I mean, like, but you might be coming to me for back pain, but I'm going to start with working on tripod foot and making sure you're actually having a good base of support. Because if you don't, then you're going to have imbalances and balance issues, and your weight's going to be off shifted, and then that's going to create torque in your spine. And I mean, it's just an endless cycle.
and that's also where we'll do another podcast on it, but it's where all these different things in your body contribute to different things. So just because your pain point is at the elbow doesn't mean that it's being caused directly at the elbow, or the trigger point is directly at the elbow. And that's a whole nother thing to go down.
Everything's a chain.
Yeah. So then I'm doing great. I'm strength training. I'm back to doing the things that I love. I have two questions. Am I more, let's start with let's do these, and we'll do one question first.
Okay.
If I'm in pain and I have not started treatment, or I'm in treatment and I'm still in pain, am I going to be in pain for the rest of my life?
Not necessarily. Most of the time, I'm going to say no. There are going to be examples or instances depending on the tissues that are involved and how plastic they are, like how much blood supply they have and their elasticity, and how well do they actually heal versus just create scar tissue. Your typical people that are having muscular issues, as long as we address the actual issues, they're probably going to be okay, as long as they maintain their program and don't return to either a sedentary life or never do those exercises, home exercises, more like accessory work again. But you do have examples like chronic ankle sprains, recurrent ankle sprains. You have damage to those ligaments, and a lot of times people are just like, oh, I've sprained my ankle, it'll be okay. But then you have plastic changes to those, and so you have inherent instability structurally. So if you're not working on the mechanics of your foot and ankle and maintaining and improving the strength, that is going to happen over and over. And there's, that can be used throughout the body. But typically the people that have pain, as long as we're improving and targeting the true issues, I wouldn't say that they would be in pain forever or, keep dealing with it.
It sounds like in some ways there you also address the second question that I had, which was, if I injure myself, am I likely to re-injure myself again? It sounds like it depends on the type of injury and where it's at. It sounds like there are things that you can do to mitigate those. But for some injuries, not necessarily. Right.
Yeah, absolutely. And you just need to be honest with your clients. It's dependent on them. A lot of times I can only give you the tools. You have to take it and maintain it and put in the work and learn how to understand your body and learn triggers, or it's where the educational component of physical therapy comes in, and making sure they understand what's caused them to get to this point and how to prevent it.
So there's different things that go in that, and we'll do, again, another show on that, but just all the things that can go into keeping you healthy once you get someone healthy. Lifestyle, huge, everything from nutrition, water intake, sleep, stress management, and then just following whatever protocol or group of exercises or warm-ups or HEPs or whatever your physical therapist has instructed you to do, just to continue doing those. A lot of times I feel like with those types of things, it's the physical therapist may say, yeah, just, you're doing great. Let's make sure you're keeping these movements in as primers or warm-ups before you do these types of movements. And sometimes down the road, we can get lazy and kind of slack off on that. So
Yeah.
just making sure that we're maintaining those things.